It's not always the chronic stuff, but that's a large focus of my practice. There are certain acute disorders, like when something just catches you by surprise, where you may need to seek the more conventional route to help recover. And that's really where that is most suitable, is in application of, conventional methods, emergency medicine in emergency situations. And what we've run into, especially in the United States, is the wide array of applications of emergency medicine or pharmacotherapies to chronic issues. And because pharmaceutical therapies tend to be pretty toxic to the body, what we're doing is we're drugging ourselves through conventional routes long term, and this can have a lot of side effects, a lot of toxic consequences. And so it's to avoid these kinds of consequences and to do a more positive approach, or to take a more positive approach to treatment and health, that we use natural approaches that work with the body, maybe at significant dosages and possibly at micro doses, like with homeopathy. Homeopathy is really centered around micro dosing. And why that works is because micro dosing breaks it down to a level where it's more easily, whatever the substance may be, more easily transported into the cells, because it's at a cellular level, the amount that's actually there. So it more easily goes in and out of cells. That's one of the strengths of homeopathy. The pharmacological approach is basically to subdue your body, to take over, to put a dosage in there that is rather large, and then depend on the body's filters to break that dosage down, like the liver and the kidneys. So the approaches that we take are more easily handled by the body, working with the body. Now, myself, I've gone through some sudden, caught me out of the blue health issues myself lately. And these were not chronic issues, although there were some chronic aspects to them that I was treating. All of a sudden, things started to get out of hand because of stressors in my life, things like that happen to everybody. And those stressors accumulated with such a punch that I got caught off guard and had some health issues come up out of the blue. And so I at first resisted the idea of using emergency medicine to approach it. But when I found that my energy level had been really drastically reduced all of a sudden overnight, then I decided, okay, I needed to go in and be checked out for some things, which I did. And a treatment protocol was designed to help me recover from that, and I am in recovery from that. But my methods will be basically the same as I do with my patients, which is, allow the conventional approach to work for a time to get stabilized. And then as I become more stabilized, then to integrate into that the more natural approaches and gradually incrementally improve my condition using natural methods and coming off of the conventional. So this is one way I do something called integrative medicine. And I do this for my patients, and I'm doing it for myself. Integrative medicine means working together, basically. We're integrating the two kinds of medicine, the natural medicine and the conventional medicine. Unfortunately, one of the things that we've run into in this country, in the United States, is that the conventional approach has many players that have a lot of pull in the country, in each state, in terms of dollars, lobbyists, etc. So it's been very difficult to integrate with the conventional approach more natural approaches. Some are starting to do that. Myself, technically, I'm a primary care physician in the state of Florida. However, even though that is the case, I'm not practicing conventional medicine. And so, because I'm not practicing conventional medicine, the primary care system, if you want to call it that, or conventional methods, don't include the medicine that I do. There are some exceptions. For example, Cancer Centers of America uses an integrative philosophy. They use conventional approaches such as chemo and radiation, which I'm not a big fan of, but that's part of their approach, combined with natural approaches from naturopaths, DOMs, or doctors of Oriental medicine, using acupuncture and many herbal methods and homeopathic methods. And then also integrated methods that include mindfulness, such as meditation, yoga, possibly Tai Chi, Qigong, these kinds of things. This approach addresses many levels of a condition. It's not just, getting the levels right in terms of the vitals, or the levels right in terms of the chemical levels or the nutritional levels of an individual. There's also the part that goes into the psychological aspect, the biopsychosocial aspects even. When we look at the biology, yes, we're addressing that, but also how comfortable is this person? How calm, how centered, how are they functioning with respect to stressors in their lives? This is one aspect that really caught me off guard, personally. And I've talked about dealing with stress, and I know all the tools and so on, and I've used many of them. But sometimes things just come at you very quickly overnight, and then you're caught off guard. And that kind of situation can get out of control very rapidly. And unfortunately, I had too many balls in the air, and therefore it did. So, when that happens, it's important to try to immerse yourself in something that covers all the bases, because your best path to recovery is by addressing all of the aspects of that recovery. And there are psychological aspects as well as physiological aspects. It's the mind, body, spirit model, if you want to call it that. So that is an integrative approach, using the emergency methods when they're required, but trying to also work with natural approaches that help to address wellness, not just not being sick or sick care, And that is a term that's often used. I hear it all the time nowadays. is people's definition of conventional medicine is sick care, because it's focused on treating sickness, not producing wellness. And part of why I'm doing fairly well at my own process of recovery is because I've been focused on this for a long time. You know, I've been in practice for about a decade, and then I had this as a hobby since I was 17. Much of what I do stems from that aspect of my life as well. So that's part of why I'm doing fairly well, even though I still experience a lot of the energy issues that came with this. And so I'm working on improving my energy levels and improving my strength and these kinds of things. So these are all aspects to be addressed. That's part of that overall picture of wellness, you know, addressing all of those aspects. The mind, body, spirit, the physiological, the psychological, all of it working together to improve and have somebody be on a path to wellness. Okay, and that this is the whole focus and, you know, basis of my practice is moving people forward on a path to wellness. And that's why I also called my show the same thing. So, you know, my experiences, I've had some issues along the way. I don't really talk about them a lot, and they're not, you know, totally unusual issues for the most part. And I have a family history that was part of my inspiration to move into this field, with my father dying as a fairly young man the day before his 45th birthday from a diabetic coma. And, you know, so diabetes became one of my focus areas to work on, you know, to improve the, you know, the prospects for people with diabetes. I've helped a lot of diabetics because of that. Other areas have come in my life, like my wife Patricia, when she had a miscarriage or two. There was an issue there, and I started working on her hormones, and that gave us and myself a little gift of our son, who's now about almost 4 years old and doing great. He's my pride and joy for sure. So, you know, there are a lot of personal interests involved in the way I do this medicine, and I have personal interests, sort of a vested interest in helping people with issues that I've faced in my life. And even before that, you know, this whole thing about fertility and so on. And you'll see probably some press about some of our successes. I know I was interviewed by Channel 10 recently, news about natural approaches to fertility. And, you know, I've been doing this also for about a decade. One of my earliest experiences in the field was as a naturopath in Australia, working for a naturopathic clinic focused largely on fertility issues and infertility treatment for couples and this kind of thing. And that was before I ever had a child. So I got a lot of vicarious joy and feelings from that experience. You know, I helped others have children, which means I was helping people bring life into the world, which I don't think there's anything more satisfying than that, except when you experience it yourself, maybe. So, and I've continued that, been helping people with, or couples with these kinds of issues for quite a while, and we've had a lot of successes recently, a lot of pregnancies. And many of these couples have been trying for a number of years unsuccessfully to have a child. And in some cases, they're getting to an age where it becomes a little more unlikely if you look at it in a conventional viewpoint, from a conventional viewpoint. Partly because conventional understanding has not really caught up with the science and the research that's involved. For example, the conventional wisdom is still that women are born with a certain number of ova or eggs, and that basically they get old and they run out of viable ova, and therefore they don't have a likelihood of having a child later in life and that kind of thing. Research has been showing since early 2000 to recently, that is not the case. And I've been operating from that premise since the first research on that subject. So what does that all mean? Well, it gets down to things like stem cells. Stem cells are where our cells originate, and then they take on certain forms. And so what has happened is the stem cells for ova have been largely missed in studies. So the development of new ova, new eggs for women does occur. That redevelopment continues to occur throughout most of a woman's life. And this is probably news to a lot of people listening right at the moment. But those conventional, that conventional understanding of a woman's situation really came down to one study back in the mid-60s, I believe it was, that looked at rats that, had a certain number of eggs, and that was kind of the way it was looked at from there on, that this is true for women and so on. But a lot of more recent studies have shown that it's not the case. Women continue to produce new ova. The presence of stem cells for the ova is pretty minuscule compared to the vast quantity of existing eggs. And this is part of why they've been missed in the past. But Harvard has gone to some extra effort to define these situations within the female body. So that's just one example of where conventional medicine is going based on old understanding. Yet, if you look at the current research, that understanding has changed drastically. I can only think of another example that comes into my mind right now, and that is with thyroid, and I've brought this up before. Conventional wisdom is that when your thyroid is elevated in function, you're not going to produce much, if any, thyroid stimulating hormone, because the thyroid doesn't need to be stimulated because it's elevated in function. And that makes some sense. And then the inverse of that, if it is low functioning, then the stimulation is going to be elevated because your body is trying to get that thyroid in gear to get your metabolism going. Again, some sense. There is some truth to that. But the problem with that is, first of all, thyroid stimulating hormone is not a thyroid hormone. Thyroid stimulating hormone is a pituitary hormone that stimulates the thyroid. So we're not actually looking at the function of the thyroid. So when a physician looks at TSH to screen for thyroid activity, they're not really looking at the thyroid. So it's a logical leap that's being made that the thyroid is or is not in good shape. Well, why do that when we have hormones that we can directly measure that look exactly at the functionality of the thyroid and the actual availability of thyroid hormone? Again, conventional wisdom, conventional training is that you use TSH as the screen. So if somebody's TSH is in the normal range, well, then their thyroid's normal and everything's good. You're fine, right? That's the statement. You're fine. Well, quite often that's not the case. There are many factors that affect the TSH level beyond thyroid function. And this is why it's not a linear correlation. It's not a direct way of looking at the functionality of the thyroid. One of those factors is stress. And stress affects the adrenal function as well. The adrenal function does affect metabolism, so it can offset some of the functionality and therefore affect the level of TSH. There are other factors, such as much as I don't believe that aging is a natural occurrence exactly. It's more of a disorder or a syndrome that just hasn't been fully addressed yet. The process involved there can affect thyroid function as well. So it then can affect TSH as well. It's not just thyroid function, but it can affect TSH. And because TSH is essentially in a loop, a closed loop with many other hormones involved, TSH itself can be affected by the levels of those other hormones. So we're talking about, sexual hormones or gonad hormones, progesterone, estrogen, testosterone. We're talking about adrenal hormones, cortisol, mineral and glucocorticoids, adrenaline, these kinds of things. So all of these are wrapped into affecting this supposed marker of thyroid function. That's not really a marker of thyroid function. It's actually a marker of the stimulation of the thyroid by your body's active elements, basically the anterior pituitary, and somewhat the influence of the hypothalamus in your brain. So you can see that there are several examples of conventional medicine operating on old paradigms. Okay? And quite often the statements come from conventional people that the natural approaches are pseudoscience, or there's no scientific basis, or the research isn't there, or these kinds of things, which is frankly hilarious, because there's huge amounts of research backing up the approach that I take in my practice. And the research is not backing up many of the approaches that are taken in conventional medicine. In fact, it's quite the opposite. Many of those methods are being proven inappropriate in the research. So to blend them together, we can use conventional approaches, but with the backing of modern research combined with natural approaches that help to adjust the body's state. And actually see improvement. You know, one of the differences between the conventional approach and the natural approach is the focus. The focus of conventional medicine is primarily symptomatic treatment, which makes sense when you view it as an emergency form of medicine. It's emergency medicine that's being applied chronically, but it's an emergency approach. The drugs are often used in emergency situations. Versus natural approaches that are focused on the underlying cause of a condition, not just treating the symptoms. And that's really a major part of the way my practice runs as well, is to focus on the underlying causes. So we actually reverse conditions that are not good conditions, obviously, health-wise. And we see recovery. I'm trying to apply some of those things for myself with my situation. I do that a lot for my patients. So we need to take another look at some of the ways we're doing things. And integrative medicine is a great approach because it ties together these differences in philosophy, but in a way that is synergistic, that gives us an end result that is to the benefit of the patient. It may not be to the benefit of the pharmaceutical companies. You know, it may not be to the benefit of the lobbyists. But it's definitely to the benefit of the patient, which is what we're supposed to be doing this for. Not just as a business or a moneymaker. You know, not just taking approaches that have been tried and true for decades, so we're doing the same thing. No. We're looking at approaches that work in terms of turning around health conditions, improving those health conditions. That's what we're talking about there. So we're focused on the underlying cause, not just the symptoms. Okay. I think it's a good time for me to take a short break, and we'll come back and kind of wrap it up. So you've been listening to A Path to Wellness on rhinoonair.com, WSPF Digital Broadcasting, DB.com. And when we come back, we'll kind of go over some of the things we're talking about here with chronic issues, treatment of chronic issues using natural approaches versus acute issues for the emergency medicine, conventional medical approach. That combination gives us tremendous value and effect. We'll talk about that. Okay. Speaking of energy, I've got some pills at the office I need to address. the ways that conventional and natural medicine can work together to create what we call integrative medicine. This model is being practiced in some areas, especially some countries around the world, very strongly. In the United States, it's kind of a new concept, considered a new concept. And I've been promoting it since I've had this radio show, and for well over 4 years in many ways. In fact, since I came back from Australia back a decade ago. So, because I saw some of what is going on there, or was going on there. What was that?
You're not a newbie.
I'm not a newbie? Okay, I'm not a newbie. That's true. That's true. Where are these differences? What is this I'm talking about? Well, at the core of some of it, with treatment of chronic disorders, one area of this kind of approach that has been promoted in this country, in the United States and Canada actually, is an area called functional medicine. And Dr. Mark Hyman is one of the initiators of that area of medicine, functional medicine. And it has to do with looking at an individual, looking at their nutritional deficiencies and addressing those nutritional deficiencies using blood work, standard kinds of testing used in conventional medicine, but not used very often actually, to figure out where those deficiencies are and addressing them appropriately. Now, what do you get as a result? You get actual improvement in physical well-being. You get turnarounds that are dramatic at times in terms of health when you actually look at what those deficiencies might be. Sometimes it's excesses, but most of the time it's deficiencies. So, quite often I find, it's just a matter of a few simple questions and I can tell whether I need to test for certain things, For example, I'll give you an example, a menstruating woman who gets very weak and tired around menstruation. And this is probably true for a lot of women listening right now. This situation quite often relates to iron deficiency anemia. So what do? You test for their iron level. Okay, so say their iron level is normal. Well, there's actually a deeper level to look into, looking at their ferritin and the saturation of their capabilities of carrying a certain level of iron. So the ferritin is more of a storage method within the body of keeping the iron in your tissues. So if you're losing a lot of blood during menstruation, then you're going to need to replace that iron, and your body pulls from its storage or resources of ferritin, converting that to bring it into your blood, for example. So you have indications of anemia, such as weakness, tiredness, fatigue. There can be fainting, there can be a more rapid heartbeat or tachycardia. There can be a lot of signs that this might be an issue. Quite often that isn't delved into in a regular checkup or a visit where somebody's gone in with a specific issue. That may not be addressed. So then it goes on, becoming more and more chronic because the levels are falling further and further and haven't been addressed. And we can have the opposite situation as well. This is an example of an excess. For example, their iron levels may be too high, their ferritin levels may be too high, be extremely high. And this can cause issues with, for example, iron manifesting in organs, too much iron being in your organs, such as your liver. This can lead to serious problems. They can look symptomatically like diabetes, like rheumatoid arthritis, can lead to things like cirrhosis of the liver, things like that. And often these issues are missed because they're not part of the conventional kind of rote methods of testing. You know, you may get an iron total, but you're not likely to see the whole range. So many of these things are missed quite commonly. And with a focus on nutritional medicine, or what's inside the body and its tissues and so on, and what may be lacking, we can correct those issues and improve one's wellness and overall health. That's functional medicine. Now, another area, and there's many other aspects of functional medicine. I've talked about the thyroid aspects. There's other kinds of deficiencies, many aspects. But it relates somewhat to an area of medicine that was initiated by the likes of Linus Pauling. Okay, so this is an individual who had multiple PhDs, who won 2 Nobel Prizes, yet his work is not studied in conventional medical schools. So maybe there's something wrong with that. But that is an approach that uses the right molecule for the job. So in other words, if there's a deficiency, then you need to replace, increase that particular molecule, and that can be iron, that can be vitamin D, it can be B12, folic acid. Many issues are caused by deficiencies of these kinds of things. And this is the concept behind both orthomolecular and functional medicine, is to address these areas that are generally omitted in regular testing. And this is why a lot of people come to my practice, A Path to Wellness, and come from a history of seeing dozens of physicians still having the same symptoms, never really being addressed to the extent that they notice any improvement. So if they're feeling down or depressed or tired, they'll get an antidepressant because that treats the symptom, but it doesn't treat the cause. So the focus of the practice, of my practice, Path to Wellness, and natural medicine in general, is to look for that underlying cause of those physiological concerns, or psychological even. Okay, so just to add something else there, with chronic disorders, quite often there is a psychological component. If you're in pain all the time, it can be depressing. It can be very tiring as well. You may have a lot of fatigue because of that. You're affecting your adrenals. It's stressful. These kinds of aspects can lead to psychological manifestations, which is one of the reasons I decided to pursue another PhD, this one in behavioral medicine, to look at the underlying physiological causes of the psychological concerns that we see. And again, unfortunately, the majority of those psychological concerns are treated symptomatically. We're using things like SSRIs, selective serotonin reuptake inhibitors, that inhibit the resorption of serotonin, keeping more serotonin available, with the assumption or the theory that serotonin is the problem. There's not enough serotonin, that's why they're depressed. Well, that's not necessarily the case. Quite often not. For example, deficiencies of vitamin D can often lead to depression. There are many issues that can lead to this kind of syndrome. So again, what we're trying to do is dig in there and using many conventional methods for testing and sometimes unconventional methods, like hair analysis, for example, can look at the minerals that are present in the tissues and give us an idea of many metabolic activities because they're correlated to certain mineral levels in the body. But typically, blood work is one of the first things we go to, and just like conventional medicine does. So I'm already practicing somewhat integrated medicine using conventional tools to delineate what's going on in a different way of approaching it, using more functional and orthomolecular medicine as part of that. So anyway, that's kind of a synopsis, looking at the way we address chronic issues using natural approaches as opposed to using the conventional approach to use more emergency methods for chronic disorders, which generally tends to lead to lots of side effects and long-term damage to the body because of those side effects and the pharmacokinetics and pharmacodynamics in terms of the breakdown of the pharmaceuticals within the body, the damage that does to the filters, the liver, the kidneys, and so on, in the gastrointestinal tract, and sometimes the bones, and many areas can be damaged because of those drugs. So merging the two together gives us a more synergistic result, and usually a much better result. And where we can go natural, we go natural. Where we have to work with more of an integrative approach using some emergency approaches, some conventional drug approaches, and use natural methods to try and sort of improve the result, and then gradually possibly move more in the natural direction over time. So there's a lot of different approaches to this based on the individual circumstances and the specific syndrome we're looking at with an individual. So I hope that gave you some insight or depth in the understanding of how we do things and why we do things the way we do them, and why we get phenomenal results in many cases, using this approach at A Path to Wellness. So if you want to get in touch with us at A Path to Wellness, the practice phone number is 727-329-9637. And our website, if you want to take a look at that, is aptw.net, short for A Path to Wellness, aptw.net. And we look forward to speaking with some of you in person about your own concerns. So thanks for listening to A Path to Wellness. And we'll talk to you next time.